How bad was the second wave of the 1918 Spanish flu? After the first wave, in the year 2020, the second wave of COVID-19 has already started in many nations, which crossed the peak of the pandemic. The first wave of COVID-19 has already claimed over 2 million lives. And this is not the first disease that can have follow-up waves. The 1918 Spanish influenza pandemic, popularly known as the Spanish flu, had a similar trajectory. The first outbreak occurred in March 1918, which subsided in the summer months. As US troops deployed en masse for the war effort in Europe, they carried the Spanish flu with them. Throughout April and May of 1918, the virus spread like wildfire through England, France, Spain, and Italy. An estimated three-quarters of the French military was infected in the spring, and as many as half of British troops. Yet the first wave of the virus didn't appear to be particularly deadly, with symptoms like high fever and malaise, usually lasting only 3 days. According to limited public health data from the time, mortality rates were similar to seasonal flu. But a far deadlier second wave started in the fall months in 1918, followed by the third wave in winter-spring of 1919. 50 million died during the Spanish flu pandemic. Though that flu is not the same as COVID-19, that pandemic does indicate how another one caused by a different virus can pan out. The beginning of the second wave. Reported cases of Spanish flu dropped off over the summer of 1918, and there was hope at the beginning of August that the virus had run its course. But it was only the calm before the storm. Somewhere in Europe, a mutated strain of the Spanish flu virus had emerged that had the power to kill a perfectly healthy young man or woman within 24 hours of showing the first signs of infection. In late August 1918, military ships departed the English port city of Plymouth, carrying troops unknowingly infected with this new, far deadlier strain of Spanish flu. As these ships arrived in cities like Brest in France, Boston in the United States, and Freetown in West Africa, the second wave of the global pandemic began. The rapid movement of soldiers around the globe was a major spreader of the disease. The entire military-industrial complex of moving lots of men and material in crowded conditions was certainly a huge contributing factor in the ways the pandemic spread. Virus killed the young, old, and in between. From September through November of 1918, the death rate from the Spanish flu skyrocketed. In the United States alone, 195,000 Americans died from the Spanish flu in just a month of October. The second wave of the Spanish flu exhibited what's called a W curve, high numbers of deaths among the young and old. That really freaked out the medical establishment. Not only was it shocking that healthy young men and women were dying by the millions worldwide, but it was also how they were dying. Struck with blistering fevers, nasal hemorrhaging, and pneumonia, the patients would drown in their own fluid-filled lungs. British military doctors conducting autopsies on soldiers killed by the second wave of the Spanish flu described the heavy damage to the lungs as similar to the effects of chemical warfare. The lack of quarantine allowed flu to spread and grow. It is believed that the rapid spread of Spanish flu in the fall of 1918 was at least partially to blame on public health officials unwilling to impose quarantines during wartime. For example, in Britain, the government officials knew full well that a strict civilian lockdown was the best way to fight the spread of the highly contagious disease. But they wouldn't risk crippling the war effort by keeping munitions factory workers and other civilians home. The public health response to the crisis in the United States was further hampered by a severe nursing shortage, as thousands of nurses had been deployed to military camps and the front lines. Medical science didn't have the tools. One of the chief reasons that the Spanish flu claimed so many lives in 1918 was that science simply didn't have the tools to develop a vaccine for the virus. Microscopes couldn't even see something as incredibly small as a virus until the 1930s. When the Spanish flu pandemic hit, scientists were intent on finding a cure for the virus. Millions of dollars were invested in the labs to develop techniques for testing for and treating the influenza, all of it for nothing. End of the second wave, but the start of the third wave. By December 1918, the deadly second wave of the Spanish flu had finally passed, but the pandemic was far from over. A third wave erupted in Australia in January 1919, and eventually worked its way back to Europe and the United States. The mortality rate of the third wave was just as high as the second wave, but the end of the war removed the conditions that allowed the disease to spread so far and so quickly. Global deaths from the third wave, while still in the millions, paled in comparison to the apocalyptic losses during the second wave. So, this was the situation in the past history of the pandemic. With the second wave, we hope the history will not be repeated its course with COVID-19. Hope you like the video. For more, subscribe to the channel. No.